Good morning. I am Dr. T. Varun Raju, Head of the Department, General and Laparoscopic Surgery at St.Theresa Hospital, Sanath Nagar Hyderabad. So today's my health topic to you all is regarding acute appendicitis. So everybody knows about the 24 hours pain abdomen which suddenly comes. Young people or middle or elderly people, they have a sudden pain around the umbilicus and fever, vomiting. Now the thing is, there are a lot of options for treating the acute appendicitis. Everybody must be knowing about the appendix, which is a finger-like projection at the junction of large intestine, small intestine, which is situated at the lower part of abdomen on the right side. So they have the pain starting around the umbilicus, gradually settle down to the right side of the lower abdomen. In females, they are confused with the menstruation or with the bleeding, ovarian cyst or some of the gynecological conditions. In males, it is confused with the lymph nodes, infections, urinary tract infection, or a stone in the ureter, kidney stone which is traveling down. So some of these are confusing things which are very common. But the thing is, the patient will be having the pain on the right lower part with the vomiting and fever. These three are very, very important. Once they are there with the patient, they will consult a surgeon, and the surgeon is going to examine the patient and he will order the investigations properly, like all the blood investigations, urine examinations, ultrasounds. And if it is confusing, then the patient may subject to go for a CT scan of the abdomen. So once it is confirmed that the patient is suffering with appendicitis, now what is the treatment now? So some of the people, they are thinking that it is going to be okay with the antibiotics, painkillers, hospital stay, IV fluids, glucose and other things. But most of the times, the treatment of choice for acute appendicitis is a laparoscopic appendicectomy. That means the appendix which got inflamed and there is no use for the appendix, it is always better to remove it. It is removed perfectly with the laparoscopic approach compared to the open surgery which was there before a longer time in the history. Nowadays everything is getting adopted and going towards the minimally invasive surgeries. Any department, any branch of the surgery or the medical field, the word is minimally invasive surgery and laparoscopy is a minimally invasive surgery. The patient will get admitted and laparoscopically the appendix is removed, and within next day, 1 or 2 days, the patient is getting discharged. And there is very small incisions, very small scars. Patients won't stay in the hospital longer times, and less analysis, painkillers and antibiotics. They can go to the job early. So those are the advantages of the minimally invasive surgery, because we don't cut the muscles. We just go through a small tube-like instruments which are called as laparoscopic telescope and the hand instruments. So they are the advantages for the minimally invasive surgery. So acute appendicitis, if it is confirmed properly by a surgeon, and it is always better to get it removed by the laparoscopy by the experienced and advanced laparoscopic surgeon. Please like our channel, subscribe, share and give comments, and press the bell icon to hear my health talks from St. Theresa Hospital, Sanath Nagar, Hyderabad.